She, staying safe, healthy, and empowered. Bodily autonomy. Me na Kadiatu Koma, and are there with Dr. Wuri Sise, a gynecologist. So now we go to menstruation. I just want to ask if you notice you period monthly. What's not the problem?
First of all, I assume say this now, God, because we don't start in period, then for whatever reason it stop, right? Because the first thing would be age. Obviously, if we talk about when I say when they deal with like 9-year-old, so a 9-year-old may or may not be menstruating. But if you got begin on starting period and then for whatever reason you stop, usually you get to do it maybe stress, you get to do certain medication, you get to do certain diseases. So you get different things that where you can make that and they happen. If not young girl begin, obviously if not older woman, they will begin talking about like mostly with infection, if person is sexually active, then the back could be one reason.
Okay, so what to make your period can be abnormal?
And when you say abnormal, we talk about maybe number of days we blank come or the cycle, the number of days we day inside the cycle. So for example, if person normal days now between 2 to 7 days. So if you get less than 2 days or more than 7 days, that's abnormal. If you cycle now day out of 35, more than 35 days or less than 21 days, that's abnormal. So again, different reasons in there. As I say, the stress, medication, it depends on the age really what they talk about. Now we're going to know like waiting at the possible causes.
Okay, so why make person in dates where you can see in period or the number of days we can see in period can change?
Alright, so normally we got begin starting period, it can come for long periods of time. Like I would say that woman will reach 20, 25 or so, maybe we'll see period 3-4 days. But that begin we just start, we go up to 7 days, sometimes even more. And then I just as the body they settle for with all the new chemical they produce. So that it can be one way. But like if you don't settle inside your cycle now, one of the major reasons that why make the cycle can change now with regards to infections, hormonal imbalance, stress na a major one as the girl begin they get older to becoming a young woman.
Okay. So why make person can miss in period? What are some of the reasons that to make person can miss in period?
Again, well, if person not starting period and missing period, the first thing we have to check for an belly, make sure see the person not pregnant. But if they would not exclude that, the stress now one of the major reasons, the infection again are one of the reasons there, which is why as much as we preach abstinence, we know say if God became sexually active, one of the things that we want for talk about obviously is condom use, because we want to make sure we prevent that infective cause of possible, possible will make person lost and missing period.
So I just want to ask something in the person belly can act we can say in period and something in other cases in the belly they act. So I just want to ask why make panic happen.
Well, we all body different for sure, but usually that pain they feel because of certain chemical that the body they produce for that wound they contract, the blood come on and do. So a normal, so to speak, that girl beginning will get small cramp. We'll give for give medicine for tell you say put hot water bottle on your belly. The other people then they get pain. Now how dare your body they work? But mostly because of the chemical that the body they produce, now they make you they get that pain they as the womb they contract or let the blood come out.
Okay, and I just want to ask where I start my period, I will get less bleeding. But as time they go on, it increase. I don't know what thinking cause
less bleeding. I feel as it can start with mostly with girl beginning and more bleeding can happen than irregularized. But definitely if girl beginning they get heavy bleeding, like they change 3-4 or more pad for a day. If they bleed for more number of days, like as I say, if they bleed for more than 7 days during your menses, finally go to your doctor, but then check them out. Different things then can be the reason. Maybe something in your cervix when they make up the womb, maybe something inside your womb when they provoke that extra bleeding day, when they will need for baby to scan for you, examine you properly. So if find an attendant, then we for go to the hospital and then check them out.
Okay, so girl begin can get belly immediately after you don't begin seeing period.
Of course. Like where the girl begin start for same period. Most of them cycles and they can be what we call anovulating, meaning mostly egg knocking come out. But nobody now don't pinpoint say, oh now at this particular point egg they begin come out. So if yes, it's very possible that it can happen, even though as I say, for the majority, most of them like now the blood they come up, but like there is no egg. But I think say it's safer that if somebody choose for start sexual intercourse, that he take the necessary preventive measures as well, so that he don't get pregnant.
Okay, so when normally girl beginning to start for sitting period?
The usual age now like 11, 12, but nowadays even earlier. Because nowadays I don't see a 9-year-old we don't start for same period. So obviously hormones and food what they eat, their environment, they all learning get effect on how soon or how late you start for same period. But mostly around 11, 12. We go begin worry if that begin the age 15, 16 and not same period age, especially if you not don't begin puberty or you not don't get hair on thy hand or thy private parts, but mostly 11, 12.
Okay, so if I bleed more than 1 month, I will be worried or not?
1 month. If you bleed more than 7 days, you will be worried. So 1 month definitely na prolonged menses. We not need to normal something. We definitely need for let the person go hospital for let them find out what's happening. But I don't advise somebody for wait stay 1 month. If you know say don't pass 1 week, please go to hospital.
So if I bleed more than 1 time per single month, I need to be worried.
Okay, so like I say, all man get in cycle and different, which means to say if you cycle now 29 day cycle and you get your period January 1, for example, then you get your period again January 29, 30, that's perfectly fine. So now the number of days in between now important, not to like for say I bleed 1 or 2 times inside the month.
Okay, thank you very much. So I just want to ask how your period they come about. What's it cause period?
Well, every month the body they ready for picking, and as the body they prepare itself, the womb they prepare itself for the belly come. So we belly no day. Now they make the south side the picking for can lay down, they call it the endometrium within the womb. Now they shed off as period every month.
Okay, so girl pikin can get belly way in a period.
Again, it depends on his cycle. Now, the man in sperm they alive for 5 days, where the egg only they alive for 24 hours. So, if you get a shorter cycle, where you likely for ovulate and I release egg earlier, if possible, depending on when inside your period you get sex, definitely.
Okay, thank you very, very much, Dr. Wusise. This message coming from Girls Empowerment Sierra Leone, a girl at a time, sponsored by the Abadi Women's Center.